Welcome to the Vet Dental Show. I'm Brett Beckman, board certified veterinary dentist, and we bring this podcast to you every Wednesday as a veterinarian, as a technician, as a dentistry team to help you be even better at veterinary dentistry in your practice. We're sponsored and partnered today with the Veterinary Dental Practitioner Program. If you're interested in being among the best anywhere in general practice as a team in veterinary dentistry, I invite you to request an invitation. Just go to ivdi.org/INV, like invitation, first three letters INV. So IVDI, International Veterinary Dentistry Institute, ivdi.org/INV, and we'll get you the information that you need.
All right, Mary writes, what are your thoughts on hand scaling versus ultrasonic? Or is that another topic for a different day? Hand scaling, I know in human medicine, human dentistry, they do primarily hand scaling. We are dealing with a little bit more debris and thicker calculus, and 99.9% of calculus in our canine and feline patients is removed with an ultrasonic scaler. It just is quicker, and we can clean above and below the gum line so that we've gotten all of that out of there, provided we're using a perio tip, so that we can get all of that off the teeth. If we did hand scaling, it would take a really, really long time. And it just is, it would be more difficult than our human counterparts, which are dealing more with soft plaque that comes off relatively easy. Most of our patients have that hardened mineralized calculus that the only way we're going to break that up and get that off is with ultrasonic scaling. Now, our hand scalers we can use in some areas where maybe we can't get our ultrasonic scaler tip, the developmental groove of a fourth premolar, that really deep indentation. A hand scaler sometimes can get in there a little bit better, but in most cases, very rarely do I use a hand scaler. I can pretty much get everything with that ultrasonic scaler. Alrighty, Carol asks, what is the difference between a periapical lucency and an abscess, and are there differences in treatment? Excellent question. I'm glad you asked this, because a lot of folks will see that bone loss and they will call it a periapical abscess. An abscess is when we have active draining pus, whether we have an open wound underneath the eye from that root, breaking through and coming to the surface, or inside if we see active draining pus from that tooth, that's an active abscess. When we just see bone loss with the absence of all of that, that's a periapical lucency. It will most likely progress to that point at some point because there's infection there, and, very typical to see that suborbital swelling and eventual, break through the skin type of abscess behavior from an infected fourth premolar. The treatment pretty much is the same. It's going to be extraction. It's going to be debriding infected bone, infected tissue around that tooth, and then closure, and then antibiotics. And antibiotics we don't typically dispense unless we have active pus, active infection post-op. We will do an ampicillin injection intraoperatively, but in many cases we don't dispense antibiotics post-op unless we have that active infection, especially that wound in the face. We're going to want to, make sure that we're covering that. The mouth has a tremendous blood supply, and there's a significant exchange, blood exchange. So all of that is kind of carrying away any, micro infection that might be there once we've extracted the tooth, debrided infected bone, debrided infected tissue, and closed with as much healthy tissue as possible. The immune system is really going to take care of anything that's left. But those are how extractions need to go, where even if it's a very loose tooth, it's not about the extraction. It's about debridement and closure, just like any other infected wound. An infected laceration is going to be debridement of all that nasty tissue and then closing with healthy margins. And that's what a skilled oral surgeon does with any of those advanced, especially advanced periodontal cases or teeth that have been fractured and it's now 2 or 3 or 4 years down the road and we've got infection surrounding that tooth. So all of that is debrided and removed as part of that patient's procedure. All right. Sonia asks, is there a sensor that you know of that is smaller than the one used? It is sometimes impossible to reach the back molars on small dogs. Yeah, there really is only the number 2. And that's what I use on everybody from a 3-pound Maltese to a 180-pound Irish Wolfhound. And it's all about, again, doing that troubleshooting and using your tube head in such a way that if you can't get that sensor all the way back, you can adjust your tube head to throw the shadow onto where your sensor is. And so in a lot of cases with those last molars, I'm going to oblique or have my tube head kind of facing back to front in order to throw that shadow forward. And so it really helps with having the tube head and knowing where your shadow is thrown based on where your sun is in relation to your sensor. So you can throw the shadow backwards onto your sensor or forward onto your sensor just by changing that side to side angle. Another question from Sonia. For chew toys, what is your best recommendation that is safe for dogs? And there's a number of toys out there and a number of, plaque prevention. And I say that with, a grain of salt because there's a lot of products out there. And we see a lot of patients that unfortunately are chewing on things that, number one, have absolutely no benefit as far as plaque prevention, even though they're marketed that way. And they can actually damage teeth. And the top 3 typically are antlers, nylobones, and bully sticks. We see a lot of fractured 4th premolars from chewing on those particular items. And so what I recommend to my clients, 2 things. Number 1, anything in the Kong line, because Kong has give to it, where they can bite down on it, but there's some absorption of that force where we're not going to have fractured teeth. And anything that is on the VOHC list as far as dental chews and any other plaque preventative type of materials, so that they have a direction to go out and look for that symbol or seal on whatever product they want to use. So some dogs have food allergies, some have other issues that they need very specific types of home care. And so if what we have that we dispense doesn't work for that patient, I have those lists printed up and are available for those guys to have and be able to still do effective plaque prevention as well as safe plaque prevention. Alrighty, Brittany asks, do you have anyone monitoring vitals while taking x-rays? In the video, you're taking cat x-rays. I didn't see any EKG leads or anyone else there with the patient. And so when I induce a patient, they are sternal at that point. I'm going to put pulse ox on them right away. I have the breathe safe monitor, so I know that they're respirating. Typically, it's only maybe 5 minutes, then I'm turning them in dorsal recumbency, and then all of those leads are going to go on. But I am monitoring that patient as I'm taking x-rays. And I'm at a point where I'm comfortable enough where I'm not overthinking x-rays. I can do those in my sleep. And the majority of my attention is on that patient. I'm going to listen for that breathe safe to beep, that I know he's breathing. With the pulse ox, I can see the heart rate. I'm looking at the mucous membranes consistently because I'm in the mouth. And so all of those parameters, so I'm monitoring that patient from the outset. And then once they're dorsal, it's much easier to get those leads on without twisting and tangling them up. And then we move on from there. But it's just a few minutes. Now, in general practice, when you're taking x-rays a little bit longer, you're concentrating on that. Yeah, you might have someone who's helping you during that time, or put the leads on right away, just so you have your comfort level is a little bit better where that patient is monitored. Because a lot of folks, they're just concentrating so hard on getting x-rays and getting good views that sometimes that takes all of your attention. So sometimes it's helpful to have help. All right, good question.
I hope you enjoyed that episode. If you'd like more information about the Veterinary Dental Practitioners Program, please submit to request an invitation at ivdi.org/INV.